What are just some common best practices and what might be some challenges when it comes to billing?
Back when I started, you had to be really, quote, creative with the billing because there was this psychiatric assessment intake code, but you could only bill it once. And so what we used to do 15 years ago was that first visit with the parents, we'd bill it as family therapy with outpatient. Then the first visit with the kid, we'd build this intake code. The second visit with the kid, we'd bill as a regular visit. And then you're doing another meeting with the family, so it becomes a family therapy session. 100% legal, but it's this sort of, that's ridiculous to think that you can do one 45-minute session with a minor and actually.
Right.
So the good news is back in 2013, people finally realized this and they created these new mental health intake codes, 90792 for prescribers and 90791 for non-prescribers. And you can bill per AMA guidelines, American Medical Association guidelines, CPT code guidelines. You can bill these codes as many times as you want during an intake process. And if you think, for example, about a non-verbal developmentally delayed autistic child, that might be a lot of visits before you're comfortable in making treatment recommendations. And so you have these psychiatric intake codes that are meant to be used now for multiple visits. I will say asterisk that in the last few years, certain insurance companies have started limiting how many times you can bill them. For example, Anthem will only let you bill a 90792 twice for a minor. So they'll only recognize one parent visit and one child visit, and then you can't bill it again, and they'll only let you bill it once for an adult. Other insurance companies, I haven't experienced that yet, and so theoretically you can bill that code for all 4 of our intake assessments for minors. But I'll say the other, and if you're a non-prescriber, that's you're have a couple less options. So you can bill you need to bill the 90791 code for an intake session, and then you can either continue to bill the 90791 depending on insurance restrictions, or you can switch to other therapy codes with the patient. For prescribers, we do have this extra code, E&M code for new patients, the 203, 99203, 204, 205 codes. These codes you can only bill once for a new patient. The interesting thing about these codes is these codes can be combined with the psychotherapy add-on code. They can also be combined with a 99417 session extender code to bill by time. So in our specific practice, and you mentioned this, and we probably talked about this, some of our insurance companies pay better for the 90792, and some pay better for the 99204 or 99205. Mm-hmm. So knowing financial, and both of them are like new patient visits. So how do you know which one to bill? Well, you should bill the one that pays you more. And so that's why, in RipsyTech, we put these CPT guardrails where if someone's billing a certain code, but they could bill another code that meets the description and pays more, we want to let clinics be able to program that in so you can alert your clinicians about, hey, consider billing this code. There is something to be careful about if you're doing a psychotherapy add-on code to a new visit appointment, and to make sure you document the psychotherapy time separately from whatever went into the intake appointment. So you need to be careful about some of those items. You can bill family therapy sessions, you could bill it as individual sessions, you've got these intake codes. There are many ways that legally, ethically, and bill these sessions, and I'd say a lot of it depends on, insurance or government reimbursement for the billing you've chosen. If you're running a cash or private practice where you get to set your own rates, you have the advantage of not having to deal with some of the illogic in reimbursement that insurance companies offer. And in general, a lot of the intake codes pay less than a follow-up visit, which is not how it should be, but just how it has panned out in the insurance industry.